Okay. So we will be recording this and it will become available on the website. Okay, I think I'll go for it. So you were all possibly expecting Emma, my colleague, who is Executive Director for Professionalisation. I am Jane Johnson. I'm AFA Executive Director for Membership Services. Emma is unfortunately unwell today, so I'm jumping in her place. And actually, from the 1st of January, Emma and I will be co-CEOs for AFA, but I will still be part of the Professional Development Committee and still very much part of these, involved in all the professional registration and the workshops. So joining me today, so as I say, I am the Executive Director for Membership Services, and my day job, I've been in the NHS 30 odd years in analysis, and just lately I've gone out as an independent consultant, still doing analysis in the NHS, but working for various consultancies. And I shall pass over to Josie, who allow her to introduce herself, and then I will come back on. So Josie.
Thanks, Jane. Yeah, I'm Josie Browning. I am one of the AFA assessors. So I assess the application forms that come in. And I'm also a member of the Professional Development Committee with AFA. I've been involved in AFA for a number of years. But my day job, I'm head of business intelligence at Gloucestershire ICB. So I work within the NHS in data and analytics, mainly from a UEC perspective. And I'll hand back to Jane and she'll take us through the process.
Thank you. So I'm going to go on to a slideshow, at which point everything in front of me that I have any control over will disappear. So I won't see the chat, I won't see hands, I won't see anything. So Josie's going to be my eyes and ears as I go through the presentation. There may be questions as we go, and if it's relevant at that point, we can answer the questions then, or we can answer at the end. But that will be Josie looking at the chat there and monitoring that. So I am now going to share my screen and go on to slideshow. Is everybody now able to see a slideshow?
Yes.
That's what
Good. Good. Because that's all I can see. I can't see anything else. So this is the introduction workshop. We do a couple of these. We do one at the beginning. So when you start your journey into professional registration, this just kind of helps you find your way. And then there's another one further on down the line in the end, just if there's any questions that anything you want clearing up. So professional registration is under the umbrella of the Federation of Informatics Professionals. They are the umbrella organisation. They are not a membership body like AFA, but they are that umbrella that various other, such as BCS, IMRI, there's other organisations that do professionalisation, professional registration onto a public register. FedIP is that governing body, and the membership organisations such as AFA use their platform for the professional registration. So when you get your professional registration, you will appear on a public register within FedIP, and this is very, very small, but it basically shows your name, but it also shows which is the membership body that you are a member of. So this will have on there your name, your level of registration, and which body you are with, which would be AFA. The AF itself, as you're all aware, I'll just quickly go through this. Member organisation for analysts, licensed by FedIP to register you all professionally. As I said, it is a registration route for analysts, and it is tailored to analysts in health and social care. So although there are organisations like BCS, it's quite generic on the sort of analysis you do. The AFA registration is much more focused on healthcare analytics, well, health and care. And we're working at expanding it to make it more friendly for data scientists, data developers, warehouse developers, etc., in line really with how the competency framework is working. It's overlooked by a professional development committee. So every time you do a registration, you have a single person will assess, and then they will take it back to the registration committee, who will look, and there are regular audits as well, just to make sure that we all agree on that registration to go through. And we're all about raising the profile of healthcare analysts, and providing that professional support network, because colleagues we work with in, well, clinical, obviously that's a given, but finance, they all are professionally registered, and they are all revered by people in the profession because of that registration. That's what we want for our analysts. So it's all about demonstrating your skills, competencies, and commitment at any stage of your career. It's an independent validation of your knowledge, skills, and abilities. So once you have that registration, it kind of validates you as a person in your role, and you can go to your exec if they're asking questions and say, well, actually I am a professional, here is my registration. It just gives you a little bit more kudos in what you do. It validates your skills. It's nothing to do with academic history. We don't say, well, you've got a couple of degrees in informatics and maths, and you've got one in history. It's nothing to do with that, and you might not have a degree. So it's not about that. It's about your skills with using the tools that you have to for your profession, and it's a verification of your competency and credibility within that profession. We are very linked to the National Competency Framework. I'm saying it now. There might be a slide about this later. Can't remember. AFA was commissioned by NHSE to help develop the National Competency Framework. And if you look at the National Competency Framework, you see there are different levels. It's done on bandings, and the professional registration is done on different levels of practitioner, senior practitioner. There is an associate, which I'll explain in a minute as well, advanced and leading. And the standards that you have to evidence tie in very closely with the different levels of the competency framework. So it's really quite useful. But you have to think of it as the competency framework, which could be used, for job descriptions, says if we are going to employ you at a band 7A to do this, or 7 to do this job, these are the skills we would expect you to have. What professional registration does, so you think of that as the toolbox. This is your toolbox to go and do this job. Professional registration is about showing your ability to use those tools. It's it's that competency. I've got a set of spanners, but I wouldn't go and use them to fix my central heating boiler. I'm not skilled. So it's about taking the tools that are required for the role and professional registration is validating that you are absolutely capable of using those tools. So the different levels here show us practitioner, senior, advanced, and leading. We have an associate practitioner level as well, which is in at the beginning here. I'm whizzing my mouse around. I don't know if you can even see my mouse, but it's at the beginning. Associate practitioner is for people coming straight into analytics. They haven't worked in analytics before. They maybe haven't worked in the NHS before. And it's slightly different. All you have to do is do, I think it's between 250 and 500 words. It's very simple. This is what my job is. This is what I do. And it's a commitment that within the next 2 years, you will apply for full professional registration. You'll still go on the register as an associate practitioner, but it's not the whole kit and caboodle that is required for the registration at the levels of practitioner, senior, advanced, or leading. The AFA website has all the documents you need. When you go on to the onto the membership pages and look at professional registration, there's buttons where you can click to apply. Now, if you want to apply, it will take you to a hub. It's online. It's not an online application. It takes you online to the forms, the application form, and the template for reflective practice, we'll explain in a minute, which can be downloaded. And once you've done your application, so you save it down onto your computer, you do your application, and once you've done, it gets uploaded back onto that hub. So it's not an online registration, it's all the forms are available online and uploaded again online. The various levels that I mentioned, practitioner, senior, advanced, and leading, this matrix kind of tells you the sort of things that we are looking for at those levels. The standards, it's the same standards for everything. You know, you got the standards under 1, 2, 3, 4, up to 9. It's just the levels that are required at that standard. So autonomy here for practitioners, you're subject to overall guidance and direction. A senior practitioner would exercise autonomy within limited parameters, advance broader but well-defined parameters, and a leading practitioner has very broad parameters on their autonomy. So the question's kind of the same. It's just the different levels. So the standards are same for every level, just what level do you reach. When you're applying, you do have to be able to achieve that level for every single standard. So you might be going through as a senior practitioner and think, oh, I'm advanced at this level, or on this question, at this requirement, I'm an advanced. Unless you can be advanced on every single question, you have to go for the one that you can cover at every question. Registration is for 3 years. You are able to apply for a higher level during that time if you wish. But if you do go through and you start picking up bits that you are, then, you know, that gives you something to work towards the next time you re-register to go for that next level up. So choose your registration level, having decided I can answer every single one at this level. Then you need to select projects and pieces of work. We use a reflective practice matrix, which I'll show you. In the old days, it used to, and please do use the new ones. If you started doing your registration 5 years ago and you've never got round to completing it, I'm sorry, but you have to use the new forms because it's changed. The questions have changed. There's fewer questions now. There used to be loads. We've condensed everything, focused everything, and we've introduced reflective practice, which we ask people to do now to showcase those projects and pieces of work. 3 reflective practice pieces is usually enough to cover everything. And then the commentary that so you do your reflective practice, and then in the actual application form under each standard, there's only a minimum amount of commentary needed because you would have covered a lot of it in your reflective practice. And the evidence that you submit, and we do ask for evidence at each level, at each requirement. Evidence can be anything. It can be a bit of code you've written. It could be a spreadsheet. It could be a PowerPoint. It could be an email from somebody thanking you for your piece of work. It could be a certificate, a CPD certificate. I'm going to say COPD, that's wrong. CPD certificate to say that you've attended a course. It could be your annual IG, security thing, that the mandatory training that everybody has to go through. It can be all sorts. If there are evidence that you can't share because of confidentiality, or you can redact things, certainly, but sometimes it might be down to a phone call. If you really can't, then we'll arrange a phone call and you can talk us through something. So nothing is insurmountable. The reflective practice, this is an example of the reflective practice. So reflective practice 1, this is the subject that they were doing, monitoring a hospital length of stay using SPC charts. This is the situation that the line manager asked to provide ongoing length of stay analysis. The surgical division didn't have any analysts within their team. So you contacted different stakeholders from the surgical division to get an idea of the measures they wanted to focus on. And it became clear, alongside overall length of stay, that they wanted to drill down at different surgical pathways. And after discussions with colleagues in information and service improvement teams, we decided the best way to analyse would be using SBC charts. Now, here you will see little red letters, numbers, alphanumeric. So this is actually standard 1.1. And this is saying that this whole question, the situation, covers standard 1.1. What I don't have in front of me is standard 1.1 to say what it is. It could be to do with communication. It could be how did you approach your piece of analytics. So as you go through, put in your standards. Then you go through the tasks. You attended a surgical assessment unit group meeting. 1.4, I don't know. I should have had them in front of me so I could read them to you. It could be something like, your communication. How do you discuss with the customer what it is they want? And as you go through the various areas here, organising a meeting with the clinical coding team, and you can see 3.2, 5.3 are covered. This P means it's being done at practitioner level. If it was SP, it would be senior practitioner, AP, advanced practitioner. This example just happens to be practitioner, but you would still have AP 1.2, 5.3, etc. Then just about what you need to do, write some SQL code, that you didn't know anything about SPC, so you got some training. So some of this is probably to do with your ongoing professional development. One of these in group 5, I think, is about, how you progress yourself, how you develop your skills. So the fact that you asked for SPC training, you've probably, achieved one of the standards there. Then the actions, attended, well, it says here, plot the dots workshop, and the evidence that's been attached for that particular skill is the e-certificate of having, attended the workshop. Here, there's some evidence attached. There's a list of codes that they were talking about, so it's probably something there. There was something here about writing their own SQL code, so I expect that evidence will be attached later showing that SQL code. So you go through, you created a pivot table, etc., the charts, and shared them at the assessment. unit group meeting. Now there's an awful lot. Presentation is attached, so that's done as evidence. Now, one piece of evidence could actually cover a multitude of standards. It's not, if there's 50 questions, there's not, I've made that up, but if there's around 50 questions, we don't expect 50 bits of evidence. You might only attach 30 bits of evidence, but one bit might be good to cover 2 or 3 standards. And then the results of the project you've been asked to do. And again, it shows here the different standards that you have achieved in doing that. So when you go onto your questionnaire and you answer 1.5 or whatever, or 1.1, you've mentioned 1.1 in the situation, you've mentioned 1.1 in the actions, the chances are when you get to do the application form itself, you won't need to write an awful lot, a few sentences, because you've said it all as part of this entire project. The second bit is what went well, just your own thoughts. There's nothing here about what standards or evidence. We just want to know that you are, how did you do it? What went well for you? What went less well? And be really honest, because that's how you develop, that's how you progress and better yourself, by learning from your mistakes. So what did you learn from that, and actually what would you do differently next time? Now there is, on the hub, when you go into the do your application, there are examples of reflective practice on there, so you can take time to go in and read them. The application form itself, there's a certain amount, your profile, we just want a few words, a bio, any published papers, conferences, presentations. When I did my first registration, I didn't put anything in there because I hadn't done anything. Well, I didn't have, I don't think I'd been talking at conferences at that point in time. I didn't have any published papers. I mean, to be fair, probably 75% of us don't have published papers, so don't be worried about things like that. And then your qualifications. Again, this isn't about your qualifications, it's just background for us on the application. It will not be used to judge whether or not you pass your registration. What we will use for that is what you put in your reflective practice and the evidence that shows that. A little bit on career history, really what your role was, the organisation, key duties. We're talking a handful of bullet points. We don't want reams and reams. And the dates you were there. You'll find this matrix in the application form, and this is really useful. So this shows here, I think I mentioned 1.1, which is about domain understanding. When you go into the questions, there will be a bit at the top that will show you an overview of what this question is about, and then you'll see the breakdowns of the different levels. Well, each application is for that level, but it will give you a fuller view of what's required.
I popped a sample in the chat from one of the standards, Jane, so people can see the kind of description you'll get in the form.
Sorry?
I popped an example in the chat for them to see.
Okay, lovely, thank you. And then use this matrix, for your reflective practices. I say you might only do 3. We think 3 is a good number. And if any of you have attended some of I think we did an online, a face-to-face workshop in Stoke when the National Competency Framework was launched. And during the session, we went through and did an actual example. Somebody stuck their hand up and, put themselves forward. And they had answered 70% of the standards within that first reflective practice. It was a nice, big, meaty one. So all your reflective practices don't have to be great big projects. You might find one big meaty one covers a lot of the standards, and then 2 or 3 other reflective practices just to wipe up the rest of them. And as you're going, just think, right, the identifying issues, that could be, as I say, minutes from a meeting on that particular reflective practice, saying that you spoke to the, the division, the surgical division, and you just wanted to understand analysis techniques. It might just be a screenshot of your code or your output. Did you use Tableau? Did you just do it in a spreadsheet? Whatever. And it could cover. So here you would put domain understanding, E1 or whatever. Just use that matrix to help yourself through. So this is an application form, and here we can see. So standard one, analytical approaches. As I say, this is practitioner level. Advanced practitioner would have AP, and the requirement of that standard would be more complex. But for practitioner level, the standard relates to your ability to perform analysis using recognized techniques with an understanding of the context of analysis. And then there's 3 parts to the question. Describe the process you use to understand the question. So that could be your minutes of the meeting that you went to discuss with the surgical division. What is it they're actually after? And your evidence would be, that. And you would say, well, I've covered that in reflective practice 1. Yeah, we discussed with the clinician, operational manager, and the, senior nurse what was required, or performance team, or whatever. Give details of how you consider the data sources and data quality issues, and then describe how you would select the tools and techniques used in your analysis, including the visualization. So you could say, well, it's length of stay, and they wanted it drilled down. So, you might have a chart where you can compare different surgical pathways. You might do it as a bar chart, and explain, I did it that way because I can show the comparison between the different pathways easier. So just why you've done that, attach a copy of that chart as your evidence, and again say, well, I spoke about that in reflective practice 1, and actually I covered it in reflective practice 2 and 3 as well, because that's what I do, analytics. Read this bit, this sentence at the top, because on some of the questions, the wording here isn't necessarily always repeated in the breakdown, but it gives you some good pointers. I think there's one where it says up here about equality and diversity, but it doesn't then mention it more specifically within the questions, and it's easy to miss. You've got to get that wording into your answers. So really good, just read this question summary at the top before you go to the breakdown. So key dates. The registration window opens on the 1st of January. We do this in a quarterly cycle. So as assessors, we know when we're going to get all the registrations through. We used to just do it any old time, and we could never plan what was coming our way. So there is a rota of how we work through. We just have brought in some more assessors because it is getting busier, and there's every possibility we will be looking for more in the near future. So January, we've got the registration window open. So you can download this stuff now. You can start now. Well, you're probably not going to do it in the next 2 weeks because it's Christmas and New Year. Well, you might do. But, it doesn't matter if you started this back in March. The only thing is you cannot do anything. You can't submit until the end of January. So the registration window, sorry, you could submit throughout January. So if you start now, you have until the 31st of January. If you, I would suggest, having done the registration a couple of times now, carve yourself up some time, take a day. If you've got a really nice employer, they might give you study time. It might be a case of annual leave or your own time or whatever. But I would suggest that you work on one bit of reflective practice and do it Don't start and then go back to it and go back to it, because you lose track of what you're doing and you think, oh God, did I cover that? And then you got to go back and reread everything, and it takes you longer than if you just focus and concentrate and get it all done. So, you might think, okay, I'm going to take 2 days next week, and I believe you could do your professional registration in a couple of days. You can submit it on the 1st of January. That's when the window opens for you to be able to upload that stuff. On the 22nd of January, there is another Q&A workshop. It's not this workshop. This one is more specific to those that have been going through their registration and have some questions. They've got a week to go before they have to submit, and they just want to clarify a few bits and pieces. So that's what that workshop is all about. And then you can get your registration in and uploaded onto the hub by the 31st of January. Then during our February PDC meeting, Professional Development Committee meeting, the applications will be assigned out to the assessors. We then have that month or so to do the assessment. We want people to pass. We don't want to make this difficult. We want to make it as pain-free as possible. We're very keen for people to realize their potential and evidence it and show it and be proud of it. So I think in all the time that I've been doing this, we've only had one or maybe two that we had to fail. There's others that haven't quite sent us everything. So we've just dropped an email and said, look, you talked about this really eloquently, but can you just send me that certificate to prove that you did your IG security training? That comes through, tick, I'm happy now. Or I've had phone calls with people. They've sent some stuff and it's not been clear. There's so much redacted. So I just got on and had a phone call with them and said, can you just talk me through your thought process and how you did it? And that's fine. And I will write on my assessor's form that, I spoke to this candidate, the evidence, wasn't sufficient, but having spoken to them, I am, assured that they have absolutely got the skills required. And then that's my recommendation that goes forward to the committee. And then at the March Professional Development Committee, all those recommendations will go in and they get signed off by the members. As I say, there are audits, there are snapshot audits. We might suddenly pick one and go through it because we have to be absolutely sure that we are following, a rigorous process and rigorous controls in what we do, and that there is parity in every single application that we assess. And also, again, sometimes it might be that we have to talk to your line manager because you can't submit something, you can't evidence something, but I can speak to your line manager and say, did they work on this project and were you happy with it? And they, 5-10 minute conversation and, tick a couple of boxes. I'm happy. So if there's something lacking in your form and you're panicking, oh, did I do enough? Don't worry, because we think it is, we will go out of our way to get that extra information from you to get that sign off done. So we are there to help you. I think that's me now. I'm going to stop sharing. Okay. And I'm back. Oh.
Did anyone have any questions or anything? It's been very, very quiet. There was one just popped in the chat, Jane.
Okay, so Rachel. Hello, Rachel. My role is less practical analysis and more strategic view of analysis use now. How recent does the evidence need to be? Okay, so I had this position because I had left my previous roles and I'm out as an independent and I didn't have access to an awful lot. I did save a lot of stuff and bring a lot of stuff with me because I like to use it as examples so I don't have to restart bits of work myself. We like evidence to be, within a year if possible. But if you're going for something like leading practitioner and one of your roles is to write a 3-year business plan, well, you're not going to have one every year. You might be coming up to that third year. So it might be 2 years and 11 months old. That's fine. We accept that some things can't be that new. And it might also not be for the organization you're working in. This isn't, it's not about your academic qualifications. It's not necessarily about the role you're in now, because if you moved into a more strategic role from a much more, analytically involved role, you might need to go back to the previous job to say, well, here is here's an example of something I did produce. So it doesn't have to be from the organization you're with. Um, Depending on what it is, it doesn't necessarily have to be that recent, but if any evidence can be within a year, I keep harping back to the IG security mandatory training that we do once a year. I don't want a certificate that's 5 years old because you need to do it every year. That's part of your professionalization, that you are an up-to-date professional. Also, you'll find that the leading practitioner one is more about strategic stuff. I found when I first did one, if you don't do analysis anymore, but you have an understanding, or you manage people that do analysis, or you have to talk to people to make them understand the context of, like if you're doing PHM, you need to be able to explain those analytical concepts, etc. So depending on the level, you might not necessarily be able to evidence certain standards. Microsoft certifications account for evidence. Yeah, yes. There's a section there on your continuing professional development, all that stuff, evidence that you are continually professionally developing. So yes, absolutely. Which is what Josie just said. Any other questions?
You're all very quiet. If you get partway through your application and you get stuck or you have some more questions, then don't forget there's the other opportunity to join us partway through the month for the Q&A session. So hopefully we can help you, support you through answering anything else that comes up.
Yeah. There might be people in your organization. Oh, and there's one thing that I didn't mention on the newest application form. If your sponsor, because you have to get somebody to sponsor you, if your sponsor is professionally registered themselves already, then they can verify the evidence for us. It just kind of makes it a bit easier and quicker for us. But it also helps you know that when you send that application off, that your evidence has already been verified and accepted. So you don't have to go into cold sweat waiting to see if anybody comes back. So if you do have anybody professionally registered in your organization, then they can be your sponsor. And you probably know people that are professionally registered, ask the questions. But there are examples on the hub, and there are recordings of sessions like this on the hub. Anyone else? No? Wow, that's good. So it gives everybody time to go and make themselves a cup of tea before, if they've got 3 o'clock meetings.
Brilliant. You got time to sign up on the FedIP website and download your forms.
Oh, the other thing, just quickly, to be professionally registered, you must, oh, okay, Louise, right, you must be an AFA member. Your professional registration runs for 3 years. You have to pay £25 a year to FedIP to be on the public register, which is a fraction of what things like BCS charge. It's also a fraction of what your nursing and, you know, finance colleagues have to pay for their registrations. So really, we're quite fortunate in that. But you also have to still be a member of AFA. So over those 3 years, you have to maintain your AFA membership and your FedIP payments. So if you're £47 a year with AFA and 25 for FedIP, then that's kind of your annual cost to be a professionally registered public register person. But as I say, it's a fraction compared to what finance and nursing clinical colleagues have to pay. So can networking be used for evidence? Yes, you know, if you go to a workshop discussing something and you've got an agenda from that workshop, that can be evidence to say, I attended this workshop, and we talked about this, and, you know, here's the agenda of what was discussed. So networking apart from conferences, if there's something that you can evidence it with, a memo, an agenda, an email, then, you know, it can be used as part probably of the communications bit. There's a standard around communications.
Oh, thank you, Jen. Thank you.
Okay. Are we all done?
Thank you.
Yeah. Okay. Off to your
Thanks,
school
everyone.
runs and your kettles and anything else. And say, come back on the 22nd of January for the Q&A workshop, so you can do that final, you know, question and answer if you've got any issues. Okay. Thank you, everyone.
Thank you.